Now let's talk about the anatomy of the nose. So first of all, it is pyramidal in shape with its root up and the base directed downwards. Nasal pyramid consists of osteocartilaginous framework which is covered by muscles and skin. Now let's talk about the osteocartilaginous framework. So first of all, its upper 1/3 is the bony part and the lower 2/3 part is the cartilaginous part. So the bony part has two nasal bones which meet in the midline and rest on the upper part of the nasal process of the frontal bones, and they are held between the frontal process of the maxilla. So here we can see these are the nasal bones. They are held between the frontal process of the maxilla and they rest on the upper part of the nasal process of the frontal bones. Now let's talk about the cartilaginous part. So it has upper lateral cartilage, lower lateral cartilage, lesser alar cartilage and septal cartilage. So now for the upper lateral cartilage, it extends from the undersurface of the nasal bones above to the alar cartilage below. So this is the mnemonic. They fuse with each other and with the upper border of the septal cartilage in the midline anteriorly. The lower free edge is seen intranasally as limen vestibuli, nasal valve or limen nasi on each side. So upper lateral cartilage will fuse with each other and with the upper part of the septal cartilage in the midline anteriorly, and the lower free edge of the upper lateral cartilage is seen intranasally as limen vestibuli, limen nasi or nasal valve on each side, as you can see here. Then we have the lower lateral cartilage, which is also known as alar cartilage. Each alar cartilage is U-shaped. It has a lateral crus which forms the ala and a medial crus which runs in the columella. Lateral crus overlaps the lower edge of the upper lateral cartilage on each side. As we can see here, this is the alar cartilage and this is the lateral crus, and this is the medial crus. Medial crus runs in the columella, lateral crus continues as the ala, and it also meets with the upper border of the upper lateral cartilage. Now let's talk about the lesser alar cartilage or the sesamoid cartilage. They are two or more in number. They lie above and lateral to the alar cartilage. The various cartilages are connected with one another and with the adjoining bones by perichondrium and periosteum. Most of the free margin of the nostril is formed of fibrofatty tissue and not the alar cartilage. Here we can see the lesser alar cartilage. So as we can see that it is also known as the sesamoid cartilage, and it can be two or more in number, and it is going to lie above and lateral to the alar cartilage. Most of the free margin of the nostril is formed of fibrofatty tissue and not the alar cartilage. Now let's talk about the septal cartilage. It is also known as the quadrilateral cartilage or the quadrangular cartilage. It has four borders, and its anterosuperior border runs from under the nasal bones to the tip of the nose. It supports the dorsum of the cartilaginous part of the nose. Now there is a condition which is called septal abscess, or after excessive removal of the septal cartilage, as in submucosal resection operation, support of the nasal dorsum is lost and supratip depression is going to result. Now let's talk about the musculature of the nose. So osteocartilaginous framework of the nose is covered by muscles which bring about movements of the tip of the nose, ala and the overlying skin. These are procerus, as we can see here. This is the procerus, and the nasalis, transverse and alar parts of the nasalis muscle. So it has a transverse part and an alar part. Levator labii superioris, nasi muscle, and anterior and posterior dilator nares, and depressor septi nasi. Okay, so these are all the muscles. Now let's talk about the nasal skin. The skin over the nasal bones and the upper lateral cartilage is thin and freely mobile, while that which is covering the alar cartilage is thick and adherent, and it contains many sebaceous glands. It is the hypertrophy of these sebaceous glands which gives rise to a lobulated tumor which is called rhinophyma.